Imagine a mother who had just experienced a normal pregnancy, a normal birth, and held a baby in her arms for 2 whole days. But then she is told that her baby has a severe deficiency. This is what the mother in my case study experienced. She experienced the first 2 days of her baby's life expecting the baby to be perfectly healthy. There were absolutely zero complications up until the 3rd day when she believed she was taking her brand new baby boy home to enjoy the rest of her life with him, or though she thought. The father of her baby soon started realizing that the baby's breathing was not normal and that he was jittery. The infant would not feed. The mother and father soon realized something was not right. This is where the case study of a 3-day-old infant with hypothermia began. A 3-day-old infant was admitted to the neonatal intensive care unit with symptoms of hypothermia. The male infant was scheduled to be released from the hospital but soon quit feeding. He was born at 37 weeks gestation to a 34-year-old mother, Gravida 3, Para 2 mother. This means the mother had 3 pregnancies but only 2 births. The infant's birth weight was 2,694 grams. The mother's blood type was B positive and she was negative for VDRL, hepatitis B surface antigen, and HIV. She is also rubella immune. The pregnancy was uncomplicated and the delivery was by cesarean section with labor. The infant's first 2 days of life were uncomplicated with normal feeding and breathing. On the 3rd day, the father noticed the infant's breathing was not normal. When neonatology was brought in for examination, its limbs were jittery, his temperature was normal, but his blood pressure with blood work was abnormal. The lungs of the patient sounded wet, and his chest x-ray showed borderline normal-sized heart and bilateral fluffy infiltrates in his lungs. His abdomen was distended, so the team placed a orogastric tube and fresh blood was removed from the stomach. After the neonatologist examined him, he was transported to the NICU without difficulty. New lab reports were done, and the team diagnosed the infant with severe deficiency of the urea cycle. According to the National Urea Cycle of Disorders Foundation, a urea cycle disorder is a genetic disorder caused by mutation that results in a deficiency of one of the 6 enzymes in the urea cycle. Now that the medical team has diagnosed the infant, they soon realize that he has hyperammonia, which is a medical emergency. The patient is in a coma, and the longer the patient is in a coma due to hyperammonia, the worse the prognosis. The team inserts a central line through the umbilical cord for the management of fluids, acidosis, and supporting his blood pressure. Ammonia needs to be removed from the body rapidly before any brain injuries occur. Hemodialysis is the quickest method to remove ammonia from the body, so it is performed as quick as possible. After the infant is stable, there will be 3 parts to maintenance therapy to ensure but not guarantee that the patient will get hyperammonia again. First is a protein-restricted diet. Next is supplementation with citrulline or agrilintine. And last, medication which provides an alternate pathway for nitrogen excretion. The patient should also take advantage of physical, occupational, and speech therapy as well as psychology and genetic counseling. Few patients with infant's deficiency live to adulthood, but early diagnosis and maintenance therapy are key to minimizing neurological sequelae. Now that the mother knows what has been going on with her brand new baby boy, now she can take him home and experience the rest of life with him. Thank you for listening to my case study.